In regards to those who are enjoying the enhanced NHIF, what happens to them?
Let me simplify this conversation. You have got an organization called NHIF, for example, and you've got an employer, and you have employees. You want employees to access an enhanced benefit. You decide to contract NHIF to provide that enhanced benefit, right? NHIF is now winding up. There's a new body coming into place. I'll say replacing it. The new body says we're not in that business anymore, right? The discussion needs to be between the employer and the employees to say, where do we get this benefit we were getting from NHIF? Where else can we get it? And there are actually other parties who can provide that service. That would be the simple answer. So that you will get the basic insurance standard package from NHIF like everybody else.
Yes.
And if you want the enhanced benefit, you need to get into conversations with a third party, possibly a private insurer, to be able to handle it. The challenge that was there with NHIF, and I'm sure this is what advised the issue of getting rid of the enhanced schemes, is when you have got a benefit that you want to get, you're providing, let's call it a business, you're doing a business. And then you have a sibling who comes and says, you know, you wash cars, let me have my car here. You charge 500, but this is me. Do it for me for 300 or 200 because you're a sibling. I'm underpricing this. If the siblings are too many, your business goes under. And this is part of the reason that was there. When you've got government coming to NHIF, there's some relationship between government and NHIF. So you're looking at each other as siblings and underpricing these schemes. When you underprice these schemes and there are too many, it drives you under. And this is part of the reason I can tell you why NHIF was having difficulty meeting its financial obligations.
Many,
yes.
Many. And a number of health institutions have raised concerns, and actually some even stopped offering services. If at all, you don't have any other cover other than NHIF.
The stoppage was
and the turnaround
temporary
time,
at best, let me tell you. It is more talk about stoppage than actual stoppage. Let me tell you, NHIF is also, even NHIF was too crucial to the operations of most facilities that they couldn't afford to do without NHIF. Let's be honest. So at the end of the day, it is an issue of being able to agitate. And the good thing is NHIF at the end of the day gets to pay. Sometimes the delays, but they were getting to pay the bills. And I'm talking for NHIF, not that I'm at NHIF at the moment, but I'm privy to a lot of its operations and what it has done. So at the end of the day, there have been challenges. And these are the challenges that we have sought to cure with these new acts and with the Social Health Authority coming into being.
And the turnaround time, because some of the institutions have stayed for months, almost even more than 6 months, that without getting any money from NHIF until they have to stop offering services to people who have to pay via their NHIF.
That discussion,
the turnaround time.
That discussion from the point of the Social Health Authority is premature. Premature because we've not gotten to that point. Secondly, we have said we have just launched the regulations at this point, and that is what we want, public participation. These are the kind of views we are going to be hearing. And whatever comes out in the final regulations, because they're the ones that operationalize the act, that is the time when we can be able to have that discussion. So it's going to determine, first of all, what financial projections we're expecting. Because, for example, if that number 2.75% changes, it changes our projections. It will also change the level of benefits that we can be able to offer. But also in terms of the regulations is where we operationalize and decide on those details of how, for example, providers get paid, how soon, how we contract them, and so on and so forth. So those are things that we are alive to because, as I've said, we're going to learn from the past. We will get views from all the stakeholders. So stakeholder engagement will occur, and this discussion will be refined as we go forward.